In our panel on classifying racism as a public health crisis. Please welcome our moderator, Cliff Barnes, partner at Epstein, Becker, and Green. Please welcome panelists, Micheline Davis, Esquire, President and CEO, National Medical Fellowships. Panelist Dr. Cedric Bright, Beistein for Medical Education and Admissions, Professor of Internal Medicine, the Brody School of Medicine at East Carolina University. Please welcome Dr. Aletha Maybank, Chief Health Equity Officer and Senior Vice President, American Medical Association.
Let's see. Good afternoon. Can everyone hear me? I think we're going to get ready. Let's see if these slides work the way they're supposed to work. Yes, the first slide is up. We're going to begin this, I think, dynamic and timely conversation with a little historical view of African Americans in the United States. And as you can see by the slide, our time in the United States has been 404 years. And during that period, 86% of the time has been slavery and apartheid. And that's the first two columns that you see on that slide. 13% of the time, about 52 years, has been spent post-apartheid, moving towards equity. There's affirmative actions that have been taken to mitigate some of the historic causes. And that's lasted up to, as a practical matter, 2017, right after President Obama left office, and we've seen a rise in pro-white supremacy as well as a denial of racism. And up till today, as of June 29th, when we got the opinion in the Students for Fair Admissions decision by the Supreme Court, which held that the Harvard admissions program violated the Constitution, the Equal Protection Clause. So that's some of the things that have occurred and where we are. The question is, how is that impacting health? And what we want to do is ask each of the panelists to make an initial comment about how our history and our current state impacts health.
Thank you so much, Clifford. I think it's incredibly important that we are looking at the current state of Black health through a lens that is actually filled with the kaleidoscope of the political determinants of health. So lots of times you will hear reference to the social determinants, and that is how you live, where you live. There's a wonderful quote by Dr. Aiton that literally indicates that your zip code has a greater determinant on your lifespan than your genetic code. Well, that is because of the environments that we live in. That is because of the way in which many of us come from environments which are either food swamps or food deserts. And none of this is happenstance. The slide before you right now shows you the impact of American slavery, the time of legalized segregation, and right now also the Civil Rights Act. But you and I both know that we are still in a period of civil rights, that healthcare is undoubtedly the civil rights issue of our time. And what we have seen, what we are seeing, is that when you live in one of the most industrialized countries in the world, that for Black and brown communities to still have issues in order to access clean, potable water, like we do in Flint, Michigan, and Jackson, Mississippi, and quite frankly, any urban environment where there is lead pipes bringing us our water, we know that we are still in the midst of a crisis. All of the zoning laws that permitted that are evidence of the systems and the policies, the rules, the regulations, and the laws that create for us environments where it is difficult for us to actually achieve sound health. So it's important that we're talking about this today on this stage at this forum because of the intersection between health and wealth, which I know my fellow panelists are going to talk to you about too, and the way in which, quite frankly, the things that literally keep the racial wealth gap in place are the same things that are keeping our health outcomes for Black Americans the worst in the nation.
So we're going to talk a little bit about some of these structured inequities. Actually, I think I'm going to pass this to you, Dr. Maybay.
Good morning, everyone. Really fantastic to be on this panel, and thank you, Micheline and NMF, for bringing us here today. And on the previous slide, actually, you saw, the graphic on the left that was well explained already, but on the right-hand side, it's this definition of racism and what we have learned and what the evidence shows us over and over again, and what we know inherently that the challenges that we do have with health system are really rooted in racism. It is racism. You can tell, I'm a rebel rouser sometimes, most of the times. You can tell, your physician or your doctors or your healthcare professionals, we understand, and these folks up here have told you that the root of some of the issues that we're having is racism. And so I always like to go through the definition of racism because I think it really helps just point out that confusion of oftentimes people have, well, is this racist or is it racist? And the reality is that racism is a system of power, right? It's power, but also oppresses people. It creates opportunities or structures opportunities that were already mentioned. It assigns value to you based on your skin color, and typically unfairly disadvantages people of color. So Black people, we are disadvantaged by the system of racism, and other people of color as well. And then unfairly advantages whites, so it benefits whites. And that, to me, is the important part that often doesn't even get discussed. We see lots of data on the disadvantages, but not on the benefits to whites in society. And as Kamara Jones will say, that completely saps the energy from our American society, the system of racism.
Yeah, you're absolutely right. But the question becomes, how do we effectuate health? And what is the impact of what you just saw in front of you? And you can see these data that we have in front of us that talk about our longevity. And particularly when we looked at what did COVID do to our health in the United States, and we actually saw a decline of almost 3 years of life expectancy in the Black community just because of COVID. But there are other chronic conditions that we have that are related to our 400 years of experience here, our post-traumatic slave syndrome, as Dr. DeGruy would say, that impact us in the aspect of what we call epigenetics. And epigenetics is the changes that happens to our genetic code because of the inflammation in our bodies that are what we call an allostatic load. And an allostatic load is just a medical term that means we have an amount of inflammation in our bodies that causes us to produce what is called more cortisone. And what that cortisol, and what that cortisol does is it increases the inflammation that leads to us having higher blood pressures. It leads to us being more prone for diabetes. It leads us to be more prone for any type of autoimmune diseases such as lupus and things of that nature. It leads us to be prone for things such as asthma. And so we need to understand that our health is a reflection of the environments that we live in, the water that we drink, the weathering that we have every time we ask the question, did that just happen to me because I'm Black? Because how much time do we spend thinking about when things happen to us, did that happen to me because I'm just Cedric? Or did that happen to me because I'm Cedric and I have a hue? Yeah. One of the things that's most interesting, I'm reading this book, is called The Sum of Us. And what it talks about is the zero-sum game and how that is the framework for everything that is done in this country. And in that zero-sum game is this aspect that for somebody to win, somebody has to lose. And we have been chosen to be the losers. And so for everything that is done, stop and think about every piece of legislation that has been written in this country. Only the Voting Rights Act and the Civil Rights Act with things that have been positively written for us. Otherwise, everything else has been written to benefit others and not us.
Let's talk a little bit. We've touched on this notion of racism in healthcare and the impact. We have the slide on the up right now that really talks about the ways in which racism impacts the social environment in which black people live. Can we talk a little bit about that?
Right. So what we want to understand is, how do we have a healthy society? And the way that we have healthy people in a society is because we have things such as prevention. We practice prevention. You know that there are two models of seeking health care. One is I proactively go to the doctor because I want to keep my health, versus I am now sick and I can't do what I normally do, so now I'm going to seek help to get back to health, okay? And so many people who are working class have the second model, that they continue to do what they do until they can't do it, and then they seek health. That's not the way that you have healthy communities. Healthy communities start through prevention, having mental health services, having cultural and linguistic appropriate competent services. That means having people that look like you treat you, and more importantly, having people that don't look like you at least be culturally humble enough to be able to ask you the questions to better understand who you are, such that they're able to treat you appropriately and individually according to what your needs are. If you don't have secure income, how healthy can you be? If you don't have secure housing, how healthy can you be? If you have neighborhoods that don't have a collective safety and efficacy, where we don't have green spaces, how healthy can we be? So we first have to look at this in reverse, and I'm gonna pass this on to Dr. Maybank to talk about the other way.
Great. So the context of what's already been talked about already is that we all heard there are many things that impact our health, and that's often the challenge within this country, is that our narrative and understanding of health is often a little bit off. It's really focused a lot of times on like the healthcare system, the hospitals, the doctors. That's what's on the right side of this graph, right? This whole context around the disease that you have, what are your risk behaviors, and how is the hospital and doctor going to help you take care of it? But the reality is that that is not sufficient enough. Only a small part of our health actually is determined by what happens in the hospitals and doctors' offices. It's important, so I don't take that away. We need insurance, we need health insurance, we need the ability to be able to treat when we have illness and disease, and also help us to prevent for immunizations and vaccines of that nature. However, that is not sufficient enough. And so when you move to the left side, you will see it says living conditions. So this was already elevated, so I'm not going to go too much in depth. Dictates how you're going to really react in terms of your bodies, the environments, the choices that you have to make, whether they're healthy or unhealthy for yourselves and for your communities and your families. And then when you go further to the left, that talks about the institutions, the laws, and the policies that are available or that are created that actually set up those living conditions. So tax policy, transportation policy, education policy, where you live, wealth, like all these policies that exist really dictate the living conditions. And then the furthest to the left, right, this is a part that rarely gets talked about, is that the lenses of like how these policies get created, through which they get created, oftentimes are through these systems of power and oppression. And I already mentioned the lens of racism. There's the lens of white supremacy. And when I say that, I mean in the context of the false notion of the hierarchy of human value based on skin color, with white being on top. That's the lenses through which oftentimes our laws and policies have been created historically and even in the present time. And it impacts the whole way down to the point of health. And there's a reason why we're picking out all of these and really educating at this point in time, because there's different strategies that you use in order to help do something. Like people are always like, how do we do something? What do we do? You know, with all this, you know, that racism is tough, right? It's huge, it's big, it's heavy. What do we do in our immediate families? What do we do in our communities? What do we do within the context of this country?
Yeah, with that question, then that's the next question. What do we do? How do we deal with it as a patient? How do we deal with it as an individual with influence in the healthcare sphere.
Thank you, Cliff. I want to make certain that you understand that what Dr. Maybank just laid out for you is actually leading up to the fact that oftentimes when people say, what is the most important thing that you can do for your health, I consistently tell them, vote. None of these systems or these structures have been created on their own. It has been the racism of the individuals who have set up the systems and the structures through which we must navigate. But we want to make certain that you don't leave here in any way as if this sounds like it is so big, it is so all-encompassing. It has actually been laid out before you for so long that it seems like there's nothing that you can do. There undoubtedly is. One is to absolutely practice that right to vote. Right? We saw this week every single person who sat out on the last election that permitted the former president to get into place to elect Supreme Court and appoint Supreme Court justices to be in place. We just saw them gut affirmative action. I am an affirmative action baby, and I'm very proud to have been. But what I'm telling you is the fact that that is going to have earth-shaking consequences on the number of black and brown physicians that there will be in this world. And so it's really important that we make certain that you understand that there are ways that you can be equipped. One, begin to educate yourself about your own health. Practice your self-care, and your best way of actually doing that is ensuring that you understand what the numbers are around healthcare disparities as they pertain to those individuals in your demographic. Two, make certain that you raise your voice when you go to see your practitioner. Three, y'all go get a black practitioner. Dr. Maybank, Dr. Bright are both NMF alumni, and I am so proud of them. But let me tell you this. We need to make certain that you are being cared for individuals who understand with cultural competence and cultural humility where you come from and respect your traditions, your culture, and everything else about it.
And to that point, that's why it's so important that we develop these programs that help create pathways for our young people to reach the point of becoming health professionals. There's nothing in healthcare that we have too many of. And any place in healthcare is a place where we all belong. And so we spend time working on developing more pathways for students to become successful, competitive as it relates to getting admissions into different schools, whether it's nursing, whether it's medicine, whether it's physical therapy. It's all important. Why is it so important? Because if we have homogeneous schools, and we go out and see a heterogeneous population, they can't understand who we are. We have to have heterogeneous schools such that people can develop that cultural competency by studying with people that don't look like them, such that maybe some of that wears off on them. And when they see somebody that looks like that classmate, they can go, hey, my classmate thought about this and thought about it this way. Maybe they do. Let me ask a question to see if that's the case.
And I think there's that part, right, and how we build. But I also think, to the point of the power that's already inherently in us and has already been in us, there's an opportunity for us to build with us and for us. We have had to do that in the past. When we're excluded from certain spaces, what do? We create historically black colleges. We create schools. We do all kinds of things, med schools, all of that, in order to ensure that we are able to educate ourselves and our children, and that continues, and it doesn't fall to the waistline, because it's exhausting, right? Many of us who are doing this work inside institutions, wherever you are, it's exhausting to have to fight, to convince people to care about us, to even just look at our humanity. And so what do we do, and where else can we put our energy? And I think at this time more than ever, we need to operate collectively. And I believe in self-care, but I also like the context of collective care. I heard Melissa Harris Perry one time call it squad care. That's how we move, right? You all are here mostly with your friends and family. We love to be in community with one another. So let's hold each other accountable, and let's help support each other in our health, but also in this important critical time where we need to fight for justice way more collectively than we ever had in my generation at least. So in addition to voting, we need to find opportunities of other organizations or other justice movements or other people that are also fighting to get people not only, to tell them to vote, but to help people get them to vote, or to find out what other people are fighting for within their neighborhoods, and the spaces that need to be created within neighborhoods so that you can be healthy. I think the biggest importance is how much we are going to rely on each other. And so this last slide actually here is called the Black Progress Index by the Brookings Institute and the NAACP. And Dr. Andre Perry, who we're all good friends with, shared this. And I think it's a really important context. A lot of the data that showed, shows the deficits, what we don't have as Black people, the gaps, more hypertension, more cancer, all those things that we need to know. But to me, we don't build from a context of deficit. We build from a context of strength and knowing what our strengths are. And so what they did with this to kind of break this down is this is looking at life expectancy again, how long we can live. And so they looked at cities across, Black cities with majority Black people across the country to see the cities that actually lived longer. And they found that a lot of some of these predominantly Black cities, people lived longer and that there were conditions that were happening there. So instead of looking what was not there, they looked at the strengths. And so in this slide, which I can't see because my glasses, on, you can see
that would be self-care.
Wow, you gotta call me up. So there's income. See, I can lean if I go lean closer. There's income, home ownership, things that actually are pretty sensible. We have a sense of. If we own a home, you're more likely to have, the opportunity to build wealth. You're actually more likely to live longer if you're able to do that, and other opportunities within your neighborhood. So the whole point is, we need to build on our strengths and our assets.
Thank you for this conversation today. We hope you enjoyed it. Key is racism does not exist in a vacuum. Policies, practices that were discussed today are what manifest it and perpetuate it. And we talked about some of the ways that each of us, including voting and taking care of ourselves, understanding how we do that as an important component to fighting racism as a public health crisis. And we want to thank you for your participation and attendance at this session today. Thank you.
Thank you so much. Last point. We got to play the long game. We spent too much time playing a short game. We need to play a long game.